Hello, and thank you for having me virtually today. I'm Jazmin Carpenter. I am the Health Projects Coordinator at the AHEC of Western Washington, and I will be discussing our AHEC Scholars Program today and how it may benefit you in your professional journey. So let's get started. What is an AHEC? The golden question. I'll give you a little background on AHECs and who's involved in the program administration of AHEC Scholars. So the purpose of AHECs are to develop and enhance education and training networks, and in turn, these networks increase diversity of health professionals, the health workforce, enhance healthcare quality, and improve healthcare delivery to rural and underserved populations. AHEC stands for the Area Health Education Center. For us, it's of Western Washington. In our region, the UW School of Medicine hosts the AHEC program office that oversees everything. So in Washington, we have four AHECs. Ours is AHEC of Western Washington, hosted at Whatcom Community College in Bellingham. There's also the Eastern Washington AHEC, hosted at Eastern Washington University, Central Washington AHEC, hosted at Wenatchee Valley College, and the Southwest Washington AHEC, hosted at the Washington Center for Community Health. So why AHEC Scholars? AHEC Scholars can help you prepare for the healthcare delivery of the future. It's a free professional development certificate awarding program for students that graduate. Rural and urban underserved communities are in dire need of a healthcare workforce that is diverse and well prepared for team-based care. So Scholars really addresses that need. And it's open to students who are in a health professions degree or program of at least 2 years that prepare them to go directly into a healthcare role, like yourself. And it involves an academic collaboration. So Western Washington University here in Bellingham facilitates the cohort. That's done virtually. We at AHEC Western Washington coordinate communications and events, and the UW School of Medicine crafts curriculum and reporting. So AHEC is a HRSA program that stands for Health Resources and Services Administration. And what these types of programs do is provide equitable health care to people who are geographically isolated and economically or medically vulnerable. They also support health infrastructure, including training of health professionals, distribution to areas where they're needed most, financial support, and the advancing of telehealth. And federal funding for AHEC scholars comes from HRSA and is supported with the funding from the Washington Department of Health. So it is an interdisciplinary educational and training program that focuses on a diverse, culturally competent healthcare workforce that specializes in rural and underserved areas. So the different colors are just kind of touching on our different emphases for scholars. So you would be part of a movement. This map shows a lot of our AHECs across the country and in the region of Washington. The larger map is even outdated now because there's a lot more than there even used to be. But this map of Washington shows where our centers serve. We're up in the left-hand corner there. And then we have the different logos of the WWAMI region. That's Washington, Wyoming, Alaska, Montana, and Idaho. So as part of the course, it's a 2-year program. In year one, we have a course for you to take. So that's 40 hours didactics, and it's a no cost, no credit course, so it's free. And Western, like I said, facilitates it using UW School of Medicine's curriculum. It will take place over Zoom meetings that are weekly, an hour and a half evening classes. And we anticipate that to start in January 2024 for this upcoming cohort. The homework is done on Canvas and you self-report your progress. And then sometimes we have potential field trip hours of an opportunity we'll let you know about that we will help you attend and get you some credit for. So for example, we have a poster session usually that can count for 10 hours of credit of CEC, which I'll touch on in a second. And then the field trip is usually 10 hours of didactic credit. So let's move on to years 1 and 2, the CEC component. So that stands for Community Clinical Experiential Learning. Kind of a mouthful, but it's pretty simple. So you would need 40 hours each year of these experiences. And in these experiences, we want you to participate and not just shadow, so you really get a hands-on. And we provide a newsletter with upcoming opportunities for CEC hours, and we have a document of opportunities in the local area as well, if you're near Bellingham. So these hours need to be in rural or underserved locations or with underserved individuals. And we can help you figure out what the exact definitions of that is. And it can be a part of your degree program that you're doing already. So if you're already getting hours like that in, that can definitely count towards scholars. It includes service learning and volunteering as well. That can definitely count for CEC. And the scholars should have an interprofessional experience interacting with providers and or students in different disciplines. So that fulfills that interdisciplinary component of the scholars program, getting to collaborate with folks from other fields. So there are 8 core topic areas that we'll touch on in the course you take. And those are interprofessional education, which supports a coordinated, patient-centered model of healthcare with an understanding of contributions from multiple healthcare professionals, kind of like I just mentioned, that we try to incorporate with the CEC hours. Next is behavioral health integration, which promotes development of integrated primary and behavioral health services to better address needs of people with mental health and substance use conditions. Then we have connecting communities and supporting health professionals. This is a newer one we have, and that aims to increase training and development of community health workers and paraprofessionals so they can be connectors and serve as a link between healthy professionals and the community and facilitate access to service. Another newer one we have is virtual learning and telehealth, which seeks to improve virtual learning and telehealth experiential training, especially following the impact of the pandemic on all healthcare systems, requiring them to rapidly implement these services and trainings. And we have social determinants of health, which are the conditions in environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. We also have cultural competency. We prefer the term cultural humility at our AHEC, which seeks to improve individual and community health by training healthcare providers to recognize and address unique culture, language, and health literacy of diverse consumers and communities. And then we have practice transformation, which aims to support quality improvement and patient-centered care through a variety of methods to support new team-based models of care delivery, including training and infrastructure support on cutting-edge technology. And finally, we have current and emerging health issues, which varies, and these are things like COVID-19, Zika virus, influenza, opioid use disorder, etc. So kind of a mouthful, but a lot of super important and interesting areas that you'll get to learn about. So the program must collect some data on students, so we want to be transparent about that. HRSA is tracking this information for 2 purposes. One is to increase access and equity in health sciences professions. And 2 is to increase the number of health professionals trained to work with underserved and vulnerable populations, which is one of our major points, and ideally choose a career working with these populations. So we want to get you in those fields. So the data they collect is demographics, number of training hours in your designated settings, and a 1-year follow-up after your graduation of your program or completion of scholars. And then the Washington AHEC program office over at UW develops a tracking database, and they'll collect your self-reported hours. And like I said, you can expect to be contacted a year after completing the program. So to touch on homework and assignments, very fun. But the coursework typically includes reading from assigned books and online articles. Oops, sorry about that. watching feature-length documentaries and additional films, hosting and responding to prompts for discussion boards, researching and preparing for the final project, and preparing for and completing weekly quizzes. It might sound like a lot, but they're pretty simple assignments, and the professor is always willing to help you accommodate this into your regular schedule. So the program pre-survey is the first thing you'll work on week 1. You complete this before your first class, just a quick survey to see where you're at. Then you'll develop a learning plan, which details your involvement with underserved communities and interprofessional experience. So that is those CEC hours I mentioned. You'll kind of map out how you plan to accomplish those in the beginning, at least. So that will take place week 2. And then weeks 1 through 8, throughout the whole course, you'll have those assignments that I mentioned, readings and videos, discussions where you respond to your colleagues. And then week 8, you'll have your final project on Canvas. And the CEC tracker is a link you'll receive once your learning plan is approved. And that's where you get to start tracking your CEC hours that you complete as you complete them. And then once you're done for the year, you'll submit them and get that all approved. And then you'll do it again in year 2. So this is a quote from a previous scholar, 2019, Shublin K. said, "Being a part of the AHEC Scholars Program gave me a new insight into the population needs in my surroundings. It was an enriching experience that nurtures my interpersonal relationship among different healthcare professionals. The team-based clinical experiences and instructive discussions help an individual to reach their best potential." So that's my presentation. Thank you for listening today. We look forward to potentially working with you in our next cohort. I know it's a lot of information to take in at once, especially if you're just starting your program, but we promise we always do our best to work with you and make it work, even though we know you have a lot going on. But we think this is a valuable experience to get you oriented with a more equitable healthcare future of delivery. So thank you for joining us, or letting me join you rather, and please reach out if you'd like to learn more. You have our website here, ahecww.org, and if you go to the project section, we have a page on AHEC Scholars. The application is open now, bit.ly/AHECWW, or you can scan the QR code here. And that is due by November 15th, 2023. And then we want to get started in the winter. So if you have any questions, please reach out to me or my colleague Stacy. Stacy will actually be leaving soon, so probably reaching out to me is your best bet, and I can connect you to someone else if needed. But again, my name's Jazmin Carpenter, the Health Projects Coordinator at AHECWW. My email address is jcarpenter@whatcom.edu. So thank you so much again for having me, and we hope to see you in the future. Bye.